Kybella is a brand name for deoxycholic acid, which is an injectable medication that dissolves fat cells. And so it basically gets injected under the skin into areas of fatty fullness and causes a reduction. Now, the process where it dissolves fat cells is exothermic and creates some type of inflammatory response. And so because of that, people get, sort of what is called like a bullfrog look or some swelling afterwards. And then as that comes down, if that fat was the problem, it'll get dissolved and shrink the area that is treated. So we get a lot of questions about surgery versus Kybella, and I think that the answer comes down to picking the right candidates. The problem is most people are not excellent Kybella candidates, and because of that, most people that I see that were treated with a fat dissolving injection have something to be desired in their result, as in they either got no response or a very minimal response, and then they spent this time and money going through this process and saw very little from it. Whereas if they had been, and the reason is because their problem was never fat in the surface under the skin. The problem was deeper. For the majority of people, the aging in the neck, the problem is deeper than this superficial area. Now, in certain patients where there's just a little bit of fat in the superficial, it may be a great option, and you'll see, really good results in those patients. But it's not going to be the same as a surgical result. And then the other option, if the problem is more superficial, is a surgical liposuction. But a lot of patients want to avoid that and stick to the injections. And so those are the patients who end up going towards the fat dissolving injections who've got the superficial fat and want to avoid like a liposuction procedure. Kybella can, just like anything else, work in an asymmetric fashion. And so if it's not injected in the right locations, or if different concentrations are injected in different areas, or if the way that your body resorbs the fat is asymmetric, then yes, you can have some hollowing, some areas that are not even, that would require some type of treatment afterwards. Kybella's downtime is significantly shorter than surgery. Surgery, in this area, liposuction procedure, we'll say, usually is about 2 weeks of swelling afterwards. Kybella is going to be shorter than that, more in the order of days. But there is significant swelling that lingers in both cases. That even Kybella can last longer than 4 or 5 days. The swelling can last longer. Surgical correction is going to be, in most patients, a longer lasting treatment. While any fat dissolving injections are going to be permanent in the sense that the fat cells that are dissolved were already treated, there's always a chance for fat to grow back with fluctuations in weight, and for continued aging of the muscle, the superficial muscle to continue to drop, or the deeper structures to continue to age. And because of that, because nothing was tightened per se, the longevity of results that I have seen tends to be shorter. So Kybella costs are going to vary a little bit based on region and which clinic you go to. I think that the thing that I often see get overlooked is generally these fat dissolving injections require multiple treatments. And what happens is once you start getting into a treatment course, when you're a couple treatments down the road, if you're not seeing a lot of results, I'll have a lot of patients that then come over after having undergone 3 or 4 treatments. Maybe they've spent a few $1,000s on injections, and really what they needed was a neck tightening procedure or to treat the deeper structure of the neck, and it was never a good option. So I think when it's the right patient, it's a great choice. And when it's not the right patient, then it ends up being a waste of time, money, recovery, and risk.